Sydney, Australia. Thank you for coming to our live stream tonight. The topic is, do you really know who is actually performing your FUE surgery? And this is going to be a topic that talks about the Australian situation. I'm lucky tonight to be joined by a distinguished panel of very experienced surgeons. So as a preamble, I want to tell you that cosmetic surgery tourism, that is Australians travelling overseas to have cosmetic surgery procedures in lower cost jurisdictions, is been happening for a long time. It's been very popular. Traditionally, the market that Australians went to was Thailand. They have no GST there. Obviously, they have a different pricing structure around wages and rents. So there's a very different marketplace, but that's been very popular. And that was never a big problem as far as we're concerned, because the most senior surgeon in Thailand is highly skilled. He's trained 45 doctors. And so the quality of the work was generally good. And even today, this senior doctor in Thailand, 85% of his male clientele comes from Australia. So that's a very traditional market. But in the last 5, 7, 8 years, it's exploded around the world. And it's become a huge industry, and it's centered in a number of countries, but the one that most people will have heard about is Turkey. And we want to discuss some of the problems associated with what we've seen with these marketplaces of cosmetic surgery tourism, because with FUE surgery, as distinguished from strip surgery, this is a model that in overseas jurisdictions, in particular low-cost jurisdictions, has been delegated from the doctor to the assistant to do the entire procedure. So, for example, in Istanbul, in Turkey, there are over 300 clinics, but maybe only 20 of them actually have a doctor who performs the surgery. So we get these wonderful ads about cheap surgery, but unfortunately, the clientele does not understand that the doctor's involvement may merely be the name on the clinic letterhead, and that there's no other involvement of the doctor in the procedure. So without further ado, I'd like to introduce our distinguished panel. They represent all of the major capital cities in Australia. So first of all, I'd like to introduce Dr. Johnathan Martinick, past president of the FRCS from Perth, Australia. Good evening, Jennifer.
Good evening, Russell. I'm happy to be part of the panel.
Thank you. Next is another past president of the FACCS, Dr. Marzola, coming from Adelaide.
Hello, everybody, and it's a pleasure to be here.
Thank you. From Melbourne, we have Dr. Vikram Jayaprakash.
Hi, everyone. Pleasure to be here as well.
From my hometown of Sydney, please welcome Dr. Johnathan Chan.
Hello, everyone. Pleasure to be here as well.
And from Brisbane, Dr. Masroor.
Hi, everyone. Yeah, it's definitely a pleasure to be on the panel.
Okay. So in front of you, you have approximately 120 years of experience in hair transplantation. These are very senior players in the Australian marketplace. So what I'd like to do is, first of all, explain this new business model with the delegation. It's not clear to the patient what they're dealing with here. And we are seeing in Australia, as we are seeing in the rest of the world, major problems associated with it. And I'd like to tick them off for the audience one by one. So I'm going to start with Dr. Martinick. I mean, it seems to me one of the big issues that we have here is the poor results that we're seeing coming back from overseas, representing both poor planning of the surgeries and poor execution of the surgeries. What's your experience in seeing some of these results coming from overseas?
Some of them are very, very sad. Some of them, there is over-harvesting, so the thought of doing further work to correct is impossible. Some of the hairs are put in on strange angles, so they're standing straight up. Some of the hairlines are too low. If you can imagine it, it happens. And of course, you've got the ones who get very poor growth for whatever reasons.
Yes, now, I mean, I don't want to say, it's fair to say that obviously there are some patients coming back from overseas jurisdictions happy with their results and with better quality surgeries. But well, unfortunately, we don't get to see them, basically, because that's not who we're going to see. We are obviously going to see the unhappy ones. But to think that there are over 300 clinics in Istanbul alone just blows everybody's mind. To think that this is such an industry over there now. So that's the first issue that we're starting to see. So thank you, Jennifer. you mentioned briefly, which I'm going to get Dr. Marzola from Adelaide to talk a bit more about, is this idea that you can go overseas, have this massive operation once in your life. Some people are advertising unlimited grafts. This is a problem about this over-harvesting that Jennifer talked about of the donor area. So would you like to expand on that a little bit, Mario?
Yes, yeah, indeed. It is very tempting to say 4,000, 5,000, go higher and higher, almost a competition to see who can do the most. But there is a limit to the very generous donor area that most of us have. And so it's a precious commodity. And once it's moved and maybe grow, maybe doesn't grow, then we've lost a lot of our reserves. And donor depletion is wrong, because if we have patches of no hair growth where there should be hair, then that looks like an illness, looks like cancer, looks like something that shouldn't be there. So donor depletion is a sad situation. I agree with Dr. Martinick. When that happens, there's not much we can do. So it's too late when the grafts are gone. And
so the consequence of that is that when people come and ask us to repair it, or to improve the situation, if the donor has been exhausted, then our hands are tied. There's really not much we can do.
Well, we can go to beard or body hair, but it's very much a second and last resort, and the results are not good. So that's the jewel that we've lost, is that reserve of good hair that can be successfully transplanted with the right result and the right care and attention.
So that leads me on to this topic of lifetime management of the patient, because clearly the model that's happening with the overseas cosmetic surgery tourism is you go over, you have your one operation, you're done for life, and that's part of the attraction, I suppose, for them to do these massive harvests and say, we're going to fix it all at once and you won't have to worry again. But Dr. Jayaprakash in Melbourne, they don't expect these people to come back to them. So there's no follow-up that we can see, and there's no long-term treatment plans that we can see. So patients often tell us, for example, that they weren't even told that there are medications to prevent future hair loss. So explain to the audience why this is such a problem.
Yeah, this is a really big concern for all of us, really, because you get these patients who are embarking on this part of their journey and having surgery without being fully informed. They're not being counseled on what medical therapy is available, what is potentially what their future loss may be. And they're just being sold that, oh, listen, you need to have a procedure and more sounds better. And then afterwards, there's little, if not any, follow-up. And so we regularly see people coming into clinic. I know you and I have specifically shared stories where people have come back from overseas and, come to us for follow-up for a procedure that they've had done overseas. And when you're trying to manage that scenario, it's kind of like trying to work with one arm tied behind your back, because you've not been present at the time of surgery. You don't have enough information to make a call. You're trying to give as much information and assistance to the patient as possible. But you're right, they're not been counseled appropriately and not been told what are the implications of all the decisions that have been made and whether or not they're willing to take medication. So we sort of have to scramble. In many cases, we do have to sort of scramble at the end to try and get the patient's level of education back up to on par of what we would deem necessary and appropriate, and then try and get them on the right path, really. So that's also a real challenge.
Yes. So yes, that's clearly part of the issue that we have. So you can have massive surgeries that are well performed, but you can over deplete the donor area. You can have massive surgeries that are well performed, but with no counselling about what lifetime needs might be with progression of hair loss. I mean, because typically the patients that we see that are coming back to us are young. And that's not a surprise, because younger patients may not be as financially secure. in their early years. So that's an added attraction really to go to a low-cost jurisdiction, but not fully understanding the idea that the doctor may not be involved. Let me ask Dr. Chan, you're a long-term practitioner in Sydney that performs FUE surgery. What's your experience with seeing people coming back from overseas jurisdictions, not just Turkey, but, are you seeing more of these cases now than before?
Definitely. I think the main thing is people are getting this information over the internet, and they actually don't have a proper doctor consultation. And quite often these patients are the ones who are emotionally affected. They are desperate, but they don't actually have the money, and they are impatient. They just want someone to go and tell them, we've got a quick fix at a cheap price, come over and do it. These are the patients that we actually don't see until they actually come back with a problem. I'm sure the one who have seen us already wouldn't actually go overseas straight away. They would actually understand the details a lot better. They understand it's not like a heart attack, you just treat the heart and not ignore the diabetes and cholesterol behind it. You have to treat the whole thing. It's a long-term thing. So I think in the last couple of years where the social medias and the internet has exploded, and we all can see that these, I can't say which country, but they're all coming up, the advertisements. So I can imagine what my patients are going through is once they Google hair transplant, they're all coming up every day in their phone. So that's the problem. I think the main thing is we are doing our job in trying to inform our patients from the beginning to the end, the short-term, the long-term management plan, everything is done properly. But it's those patients who actually don't come to see a doctor in the first place that are the problems, unfortunately.
I wish you were completely correct about if they've already seen us or had an operation, they wouldn't go overseas. But that, curiously, I got a call on Monday from a patient who had an operation in Asia on Friday, a previous operation of mine, which he'd been happy with, but he'd lost a bit more hair. Decided to go to Asia and had his operation on Friday and rang me in a panic on Monday about his new hairline, that he thought they'd been a bit creative in the operation and gone a bit beyond the bounds of what he'd asked for. So I think there is an attraction there, even for people that have been to see us and been operated on us, to go to low-cost jurisdictions. I don't think it's entirely people that are untouched. Sometimes it's going to be those people as well. What about in Brisbane, Dr. Alam? What's your experience up there?
Sorry about
You're breaking up at the moment, Dr. Alam, so your microphone's being a bit variable.
Can you hear me?
Yes, I can. So what's your experience with patients coming back from overseas surgeries in Brisbane? Has that become a big problem for you?
We do see them from time to time. In fact, was a patient again was very unhappy with surgery.
Your microphone's still playing up, Dr. Alam.
Is it my microphone or is it my voice? Because I've got a bit of hoarse voice at the
No, it's better now.
It's better now. Okay, I'll bring it closer to my face. Okay, can you hear me clearly?
Yes, I can.
Okay, so now we do get to see them from time to time, but not as many as probably Melbourne and Sydney see them. In fact, our own patients are mostly from Melbourne and other states than in Queensland, but almost like 50% from Queensland, the rest from other states. However, we do see them from time to time from overseas. And I was telling you about one of the patients who was going to take legal action against one of the overseas practice. And he was countersued by them. They were so strong having legal representation here in this country from overseas that they could countersue him. And the poor guy was crying in front of me what to do. So marketing is the main thing that they rely upon, the internet marketing. And obviously, we get a variety of them via email and other social media as well. And people get lured to them because of low prices. Complications are not high as far as I see, because sometimes we do see patients who are done overseas and they come back for more here. But those that we see there can be horrible. As early on, you guys said, depletion of the donor area, abnormal looking hairline, all the plugging, all that sort of thing. So Yes, the numbers in Brisbane are not too high from overseas, but we do see them from time to time.
Okay. Well, it's going to be no surprise, when I explain to our audience that we now have a profusion of copycat clinics in Australia whose express plan is to trap or capture some of that market, if you like. So the advertising is quite obvious for the websites of these clinics. These are clinics that the doctor does not touch the patient. There are at least 3 of them in Sydney. I'm sure there are some in Melbourne. I'm sure they're everywhere, because it appears like these clinics are exploding week by week. And the situation is that the surgery, as I said, is performed by a technician of some sort. The level of training of that technician is unclear. The doctor himself, it appears, doesn't have to have any experience whatsoever in hair transplantation. He just has to have a medical license. We had a patient who contacted me a couple of years ago about a poor experience with one of these clinics, and he took a complaint to what we have in Australia called the Healthcare Complaints Commission, which is where these things can be dealt with. And he made his complaint, and then there was a bit of backwards and forwards. And I wrote a letter to the Healthcare Complaints Commission and said, look, I'm concerned about this delegation model, because I know that in this clinic the doctor does not touch the patient. That some kind of surgical technician does the entire FUE operation, which is the drilling out of the grafts, the harvest, the making the recipient sites, and the planting. So basically, the doctor is a passenger or an observer. And the response I got from the Healthcare Complaints Commission was that the internal medical advice was that it was okay legally for that to happen, as long as A, a doctor was on the premises, and B, that the delegation was to a trained healthcare professional. So I was so stunned by this letter that came back to me that I immediately rang them and rang the person who'd written the letter and said, well, that's okay. I'm quite surprised that you think that's okay, because it's a much more sophisticated procedure than you possibly know. And I don't think any of my colleagues have been contacted by anybody from the HCCC to find out what the level of expertise would be required to do the hair transplant. But what is your definition of the trained healthcare professional that you're going to let do this procedure? And they said, well, we don't have a definition. And I was just perplexed, stunned. I mean, this looks like a classic loophole in the Australian regulations, where there is so much going on. They're saying, oh, well, our advice is, as long as it's a trained healthcare professional, it's okay. But they can't define what a trained healthcare professional is. So the problem for the audience is that that's basically open slather. In the current regulatory requirement in Australia, there is no definition of who's allowed to perform your hair transplant as an FUE procedure, as long as there's a doctor on the premises. And this is going to create enormous problems, because the 2 parts of the transplant that you've heard from all of these esteemed surgeons tonight is that there's the planning aspect of it, which is hairline design, making sure that you've got an appropriate number of grafts to treat the areas appropriately and to give good advice. Because baldness is a lifelong problem. It's an expanding problem, right? People don't grow more hair as they get older, they grow less hair as they get older, and people forget this. Patients are not really clear about this. So the fact that you've got to have the planning skills to work about what the next 10, 20, 30 years is going to look like, and then you've got to have the execution skills. It's one thing to be able to harvest a graft and plant it. It's another thing to make sure that it's been done accurately so that the hairs will actually grow. So there's quite a lot of skills associated with it, and this is underestimated generally by people that I talk to. They think it's a very simple procedure. You just pluck them out and plant them, and how hard can it be? But it is a much more sophisticated procedure than that. So basically, I think that one of the things I'd like, again, to try and help the general public understand is that, there are some things that I think that are going to be very important, because if you're going to go overseas, which is what we're not telling you that you can't go overseas, what we're telling you is that these jurisdictions that are very cheap have a number of reasons why they're cheap. And one of the reasons is there's no doctor in the procedure. So I think it's very, very important, if you're going to undergo a surgical procedure, and let's not pretend that it's not a surgical procedure, because it is a surgical procedure, that, you know, basically you need to know who's doing the operation. So I think the first recommendation, what do you think about this, Dr. Marzola, that, you know, if it's going to be overseas, surely they should have a telehealth consultation with the surgeon, because typically in this environment, it's with a consultant salesman.
Well, we have that opinion, Russell, and this panel will all agree. And most sensible people would also, because of the limited resource, and if we mess it up, well, it's too late. And so, yes, encourage everybody to have a telehealth consultation with a professional. But it doesn't happen with these clinics. And in fact, there may not be a medically trained person on the premises.
Well, shouldn't that be a red flag?
Absolutely.
Yes. Well, I think that's a take-home message. I think that if you can't speak to the surgeon, you can't ascertain the level of experience of the person who's actually performing the surgery, that should be a red flag. So, you know, even if you do talk to a person purporting by telehealth to be the surgeon, I think, again, you need to be absolutely sure that that's the person who's going to be there on the day to operate on you. Because, Jennifer, it's pretty clear that the flashy advertising that they do, Dr. Martinick, flashy advertising that they do, often has before and after photos that don't actually represent the work of that clinic.
That is very true. Often the pictures can be doctored, but they also can be taken from the websites of well-known international doctors from Canada, the US, Australia, and purporting to be their own work.
So again, that's something that needs to be very clear, that if you're going to undertake a surgical procedure overseas, you need to do your homework. I think the other thing that is very clear, and it comes back to what we talked about before, Dr. Jayaprakash, is it's all very well for patients to go overseas and have the procedure, but the most advice I've ever seen from an overseas clinic was to sell the patient after the operation 3 empty test tubes for $300 and tell them to bring them back to Australia and then present them to me so that I could do the PRP, the blood centrifuge and the injection in the scalp as the post-operative treatment. They actually used my name, which bemused me, but they sold them 3 empty tubes, and that was their commitment to future treatment. So I think, again, going back to what you said before, clearly, you know, there needs to be discussion with the clinic about what they would be recommending for long-term treatment.
Yeah, but I also think, you know, it's really important that the patient is educated. And we talk about hair loss being a journey, and, you know, it's a lifelong thing. And as you said before, hair loss is a progressive and expanding condition. So, you know, having a hair transplant now is just one, you know, one point on that journey. And you have to understand that there may be other destinations or other stops along the way, and other treatment options that you have to undertake. And it's important for the patient to understand and be educated on that, because, you know, it comes down to the experience, you know, what you were talking about before. It comes down to the experience of the individual who's performing it. You know, it's not just about, can you pick up an FUE punch and can you harvest the graft without transecting it? That's fine. That's a teachable skill. That's not the problem. The key is, which grafts are you going to harvest? Which ones are you going to leave behind? Because in a young individual, you can harvest 4,000, 5,000 grafts, and the effect of youth will hide all sorts of, you know, problems that may occur, which, as the patient ages and the hair, you know, thins out, will become more apparent and look more, the area will look more deplete over time. So it's imperative that the patient actually understands that that's a risk before they embark on any procedure, and especially if they're doing one which is potentially delegated to someone else who just may be looking at doing, just robotically doing multiple a set number of punches in a certain area without thinking, right, what are the long-term consequences? And that is only from experience and knowledge and having, an understanding of the process.
So, Dr. Chan, have you had the same experience I've had of young men coming along and saying, I don't want to take medication for the rest of my life or for any period of time. I just want to have a hair transplant and fix the problem permanently?
Yes, totally. In fact, I actually have a lot of patients not aware, even if they had a telehealth consultation overseas, that there is limited supply, there's ongoing loss, and the hair that they take from the back don't actually grow back from the back. So the patient actually don't even know that. So the problem is they don't understand the whole process. And that's why all they read about is the negative comment about side effects of all drugs. Whenever you mention medication, they just put a wall in front of you. It's our job as a doctor. I mean, no one wants, even high blood pressure, diabetes, no one wants to take long-term medication. But it always happens if the doctor explains it properly. But I mean, there are patients who insist they won't take it, but it is our job to say, no, I'm sorry, this is not the right choice for you. And I actually have complaints that the doctor don't want to do the surgery on the patient before. And the patient got very angry. But in the long term, I think I'm doing him a favor and putting my reputation, saving my own reputation as well. And that's all we can do. We can't save the world. We can't save everyone. But we have to try our best to educate those that are actually just a little bit not understanding, misled by other people. We can actually bring them back. And we have done, I mean, we all have done that before. Try to educate a patient, and there are some that we can actually save. So,
I mean, some of the FRCS clinics, Dr. Alam, are spending, like 100,000 euros a month on advertising on social media. I mean, that completely swamps the ability of traditional doctors to be involved in that marketplace. And they all make it seem so easy, don't they, with the advertising? But again, it comes back to, do you refuse to operate on patients that won't take medication, Dr. Alam, or do you explain, what the consequences of not taking ongoing medication is going to mean?
Yeah, we, like Dr. Chan was saying, we try and educate them. Sorry, I have to bring the mic closer to me. We try and educate them as much as we can about, especially the younger people who are receding or which I tell them that we don't want to be chasing the hairline all the time. So better to stop or slow down the hair loss first before we do any type of surgery. Most people understand if it's clearly explained to them. Some would refuse. Some are adamant that now I'm not going to take any medication. It'll make me less of a man and blah, blah, blah. So there are cases. Now we tell them, we warn them that, okay, if we do the hair transplant, these are the consequences, that you will still continue to lose hair. The results may not be a good one because it's a combination of the new hair and the existing hair that gives you the results. So yeah, there are, I would say that too many. There may be 10 to 20% of the people who wouldn't like to take any medication, no matter what kind of explanation you give to them.
Okay, so I have two answers for them. First of all, I tell them that because baldness is progressive, I'm calling it their first operation for a reason. There will be more. The second thing I tell them is that if they take medication and they stop taking medication, or the medication isn't completely effective, the worst thing that can happen to them is that they bald naturally. But once I've operated on them, if they stop taking the medication, or they won't take the medication, or the medication isn't effective and the baldness progresses, now they will bald unnaturally, because there is the hairs that we have transplanted that will stick around, and then there are hairs that will not stick around, and that will not be a natural pattern of balding anymore. So that's the way I try to explain it to them. And my experience is that most people, if it's explained to them properly, will understand the consequences of it. And even if they are unwilling to take medication, at least they have been told what to expect. So does anybody, as we conclude, have any other questions that they'd like to pose or comments they'd like to make?
Just on that subject, Russell, with the increasing numbers and most of the donor having been taken, and then there's no maintenance medication, or they decide to stop it. The biggest transplants are the ones that look the worst. And so if it was 1,000, 2,000 grafts, it can look bad. But if it's 4,000 or 5,000 grafts, then it really looks terrible.
That's right. Yeah,
without maintenance.
I think the area that we worry about with our young men is the transplanting in the posterior part here. This is the area that's going to get them into a lot of trouble, the crown. So basically, I want to thank you all for your input tonight. I want to explain to the audience, this is not special pleading from Australian surgeons saying, come and see us instead. That's not the message tonight. The message is, if you're going to go overseas, do your homework. It's not an easy procedure to perform. It's made out in the advertising that it's a very straightforward, simple process. It is not. There is a lot of planning, a lot of organization. It's a team operation that requires a great degree of coordination and skill to make sure that the graft survives its passage from the back of the scalp to the upper scalp. There's many moving parts to it. And there are many great clinics overseas that are manned by world-class doctors. There's no doubt about that. And they do exist in low-cost destinations. But it's imperative that you understand that this is a significant procedure that requires significant skills, and that you should be very careful to do your research as best you can and make sure that you're going to somebody who is going to listen to you, communicate with you, and together work on a plan that's a long-term plan, not just a short-term plan that's an instant fix, which certainly isn't going to be an instant fix for the next 50 years. So I want to thank all the panelists tonight. I want to thank those who are watching the live stream here. I hope this has been some assistance to you. And I hope that you make some good decisions, and the information you're given tonight helps you in that regard. Thank you all.
Thank you.
Yeah, thank you.
Thank you.